Module 17, Patient or Resident Abuse. Section 1, Define key terminology. A. Review the terms listed in the terminology section. B. Spell the listed terms accurately. C. Pronounce the terms correctly. And D. Use the terms in their proper context. Section 2, Types of Elder Abuse. Define abuse. It's an intentional act or failure to act by a caregiver or another person in a relationship involving an expectation of trust that causes or creates a risk of harm to an older adult who is someone age 60 or older. B. A crime that is one or more of the following elements: willfully causing injury, unreasonable confinement, intimidation, making someone afraid, punishment, refusal of goods or services needed for physical, mental, or psychological well-being. It can happen to any older person, but often affects those who depend on others for help with activities of everyday life. Likely targets are older people who have no family or friends nearby, and people with disabilities, memory problems, cognitive problems, or dementia. Forms or types of elder abuse, as defined by the National Institute of Aging. 1. Verbal: teasing, profanity, racial slanders, threats. 2. Physical: battery, such as kicking, biting, hitting, shoving, or pulling hair. And rough handling. 3. Psychological or emotional abuse: ridiculing or saying hurtful words, ignoring repeatedly, manipulating, and yelling at or threatening. 4. Involuntary seclusion: isolation, keeping that person from seeing close friends and relatives. 5. Abandonment, leaving someone unattended, no planning for patients' or residents' care. 6. Neglect, failure to provide care that a reasonable person would provide, not answering a call light, smells of urine not being cleaned or changed. 7. Sexual: overtures or innuendos, inappropriate gestures, inappropriate touching, forcing an older person to watch or be part of sexual acts. 8. Financial: stealing money or borrowing items, accepting gifts. May include forging checks, taking someone else's retirement and Social Security benefits, using another person's credit cards and bank accounts, changing names on a will, bank account, life insurance, policy, or title to a house without permission from the older person. 9. Healthcare fraud: overcharging, billing twice for the same service, falsifying Medicaid or Medicare claims, charging for care that was not provided, committed by healthcare providers or hospital staff. Signs and symptoms of abuse: has new onset sleeping problems, seems depressed or confused, loses weight for no reason, displays signs of trauma like rocking back and forth, acts agitated or violent, becomes withdrawn, stops taking part in activities that the patient or resident previously liked, has unexplained bruises, burns, or scars, appears unkempt or messy with unwashed hair and dirty clothes, or develops bed sores or other preventable conditions. Section 3, Issues related to elder abuse. Abuse is a crime and is one or more of the following elements: willful causing of injury, unreasonable confinement, intimidation or making someone afraid, punishment, refusal of goods or services needed for physical, mental, or psychological well-being. Elder abuse has been poorly or imprecisely defined. Defined specifically to reflect the unique statutes or conditions present in specific states, counties, or cities. Defined specifically for research purposes. All states require the reporting of elder abuse or child abuse. For forms of elder abuse, please refer to Section 2. Recognizing the evidence and observation of elder abuse. Living conditions are unsafe, unclean, or inadequate. Personal hygiene is lacking. Weight loss, frequent injuries, old bruises, quiet and withdrawn attitude, anxious to please caregiver. Private conversations not allowed. Medications not taken properly. Frequent visits to the ER, hospitals, or clinics. May go from one doctor to another. Series of actions and reactions might lead to abuse. Local, state, and federal regulations elect the nurse assistant as a mandated elder abuse reporter. Section 4. The nurse assistant role in recognizing and preventing elder abuse. Negligence means when due care is not given to the resident. It is a form of resident abuse. Signs of elder abuse. Living conditions are unsafe, unclean, or inadequate. Personal hygiene is lacking. Weight loss, frequent injuries, old bruises, quiet and withdrawn attitude, anxious to please caregiver. Private conversations not allowed. Medications not taken properly. Frequent visits to the ER, hospitals, or clinics. May go from one doctor to another. Nurse assistant role in preventing abuse. Identify combination of individual, relational, community, and societal factors that contribute to the risk of abuse. Current diagnosis of mental illness. Current abuse of alcohol. High levels of hostility. Poor or inadequate preparation or training for caregiving responsibilities. Assumption of caregiving responsibilities at an early age. Inadequate coping skills. Exposure to abuse as a child. High financial and emotional dependence upon a vulnerable elder. Lack of support. Unsympathetic or negative attitude toward patients or residents. Chronic staffing problems. Lack of administrative oversight, staff burnout, and stressful working conditions. Patient or resident safety and abuse prevention techniques. Effective monitoring systems. Institutional policies and procedures regarding patient care. Training on elder abuse and neglect for employees. Education and clear guidance on durable power of attorney and how it is used. Promoting regular visits by family members, volunteers, and social workers. Coordination of resources and services among community agencies and organizations. How to prevent violations of elder abuse and discuss techniques to rectify situations that could possibly lead to abuse. Provide services to relieve the burden of caregiving, such as housekeeping and meal preparation, respite care, education, support groups, and daycare. Estate planning including living will, revocable trust, durable power of attorney for health care and/or asset management. Not signing documents without first consulting an attorney or family member you trust. Do not provide personal information such as social security numbers, credit cards, etc. Tear up or shred credit card receipts, bank statements, and financial records before disposing of them. If you hire someone for personal assistance services, in-home care services, etc., ensure that they have been properly screened with criminal background checks completed. Review mandated reporter role, self-care techniques. Caregiver. Caregiver may need to be available around the clock to fix meals, provide nursing care, take care of laundry and cleaning, drive to doctor's appointments, and pay bills, which contributes to caregiver stress. Make sure you have time to rest and take care of your needs. Ask a family member or friend to help out for a weekend or even a few hours, so you can take some time for yourself.